Good afternoon, everyone. I would like to call the Human Services Committee and the Human Services Board to order. This agenda was posted in the office of the County Clerk on the 18th day of March, 2021. Notice was sent to the West Bend Daily News, Express News, WIBD, WMBZ Radio, WTKM Radio, My Community Now, Hartford Times Press, Kewaskum Statesman, and Milwaukee Journal Sentinel. We do have a quorum of both the committee and the board. And at this point, I would ask that you rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. For those in our audience today, as well as those who may be watching this meeting virtually, this is a meeting of two separate entities. The Human Services Board consists of members of the Human Service Committee, who are all supervisors, as well as citizen representatives. This board is required by Wisconsin state statutes, and its duty includes recommending program priorities and policies, identifying unmet service needs, and planning budgets to meet those needs. The Human Services Committee is the oversight committee for several Washington County departments, as well as the Human Services Department. All the members are county board supervisors. The other departments include the Health Department, the Aging and Disability Resource Center, the Samaritan, and the Veterans Services Office. We do have two discussion items on the agenda today that are to be in front of the Human Services Board. And once those two items have been taken care of, the members of the board, the citizen reps, will be dismissed, but if they care to stay and listen to the action item, they're more than welcome to do so. So with that, the next item on the agenda is our consent agenda, and I would entertain a motion to approve that.
So moved.
Is there a second? Pam? All right, we have a motion and a second. All those in favor, please signify by saying aye.
Aye.
Aye. Opposed? And that motion carries. All right. Then we go on to our discussion items. The first item is 2021 updated user fees, Health and Human Services. This is a board item, and Julie, I would assume you're going to take care of this item.
Yes, that's correct. So Julie Driscoll, I'm Health and Human Services Director. So the first item for discussion is, as you may recall, every year when we do our budgetary request, we do include the updated user fees, which is required by statutory guidelines. Those user fees were approved along with our budget back in September, October or something. But we do have an update, as we did get an updated guidance from Social Security Administration. So currently we are representative payee for several clients within the Human Services Division, where we're charged with helping them to make sure that they are budgeting accordingly and paying their bills accordingly. And we can charge a fee for that, and that is up to $45 a month that we can charge for the services of that representative payee. Social Security Administration has provided us a guidance that if somebody has a substance use disorder, we can charge 10% or up to $84 a month. So we are updating our user fees and posting that, and we've provided that update to our clientele, and are then responsible for updating the board as to this change in fee structure for our clients, and hear any feedback that you might have.
What was the figure? Was that 34?
So it's $45 for general representative payee, but if somebody has a substance use disorder, we can charge up to $84. It's generally 10% of their Social Security allotment per month.
All right, thank you.
Any other questions from anyone? I do have some. Leave it to me. Under the Children and Families Division user fees,
Mhm.
There is a asterisk there that says on those amounts pending state approval and release of the 2021 rates. When does the state usually do that?
So we generally get our rates for the next year around December. So we did get our updated rates for what it costs for kids for out-of-home care.
For this year?
Yes.
Okay. And then my other question was on the custody studies. How do we compare with surrounding counties as far as what we charge? Do you know offhand?
So I know that we do, the folks who put the user fees together do comparison. I couldn't tell you off the top of my head in what we compare it to, but they are supposed to be usual and customary, and we cannot charge anything that's not aligned with either what is our rate that would be charged to a general customer or a general constituent, and so that the state approves as well.
Okay.
So I couldn't give you the numbers off the top of my head, but they are aligned.
Okay. Thank you. I only asked because years ago they always used to compare with Ozaki and Waukesha. And you gave us a lot of information on all the user fees. How are the collections of these fees for the most part? Do we get them as ordered on here? And if you don't, then what happens?
Yeah, so generally a couple of different things happen in collection of fees, especially like when it comes down to these fees for representative payee, people do have the ability to submit a request to us based on, financial hardship to have their fee reduced. And we always do take that into consideration and have provided approval for people who have financial hardship based on their individual circumstances. Then in general, we do two things for collecting. We have really seen in the last couple of years the increased percentage of ability to actually bring in collection. And we've been able to we budget that or allocate that out to our budget. And we've been able to increase that every year. We do some collection services and tax interception. Primarily, I would say in the Children and Families Division when it's related to either custody studies or kids in out-of-home care. In behavioral health, because generally most people are low income and don't have insurance, we tend to work with them a little bit more. We're not interested in, trying to make somebody, claim bankruptcy because they receive services from us. So we do work with people as much as we can. And then at the end of the year, we just write off, anything that we cannot claim.
Okay, thank you. Yes.
Okay. The question I had then, so the bad debt that we approved last year, it would come back to us to review it again?
So the bad debt you approved was for the Samaritan. You don't approve bad debt for human services.
And why is that?
Because it's not, because the Samaritan is an enterprise.
Oh, okay.
And we budget our fees, that revenue that we collect based on projection. So it's not something that keeps us in business, so to speak, because at the same time, we do offer lots of services that are free.
Okay, thank you.
Yep.
All right. Yes. Did you have some? Who had a question? Oh. Oh, all right. Good report, Julie.
Thank you.
All right. Then we go on to the next one, which has to do with 2020 year end inpatient hospitalization out-of-home care.
Yep. So what you have before you this month is just the inpatient hospitalization for 2020. We will be presenting the out-of-home care at a later date. We're finalizing some numbers there. Typically, over the last several years, we've brought these reports to this board quarterly. I think with COVID and we canceled a lot of meetings last year, that we sort of got out of the habit of bringing these numbers to you quarterly. So I did want to bring to you the end of the year, and then we will be submitting this to this committee and to the board quarterly to let you know where we are. So I want to just start with letting you know that our budget overall for human services came in under budget. So in no way are we over budget and having to tell the county board that we overspent our budget. That's just not the case. However, as you may know and do know, the two biggest drivers for our budget is out-of-home care for kids and inpatient hospitalizations. And we budget for those two budget items as best as we can and based on projection, but there's not a lot that we can do if we exceed those budgetary numbers, which is why we try to pay very close attention to the other line items in our budget so that we can overall come in under budget. So for 2020, you'll see that we budgeted around $905,000. And our overall cost came in at $82,942.61, which means that we overspent our inpatient hospitalization budget by $377,942.61. It does break down what hospitals that those were paid out to. And in the following sheets, you can get lots of data if you really want to get into some spreadsheets around budgetary numbers that tells you past years and different hospitalizations. I will share with you that we had 231 emergency detentions last year, and we're seeing across the state about a 58% increase in emergency detentions overall. We did have 32 voluntary admissions, which means that we, in the crisis moment, we were able to get the individual to agree to hospitalization without taking them under emergency detention. And then generally, then the county is not responsible for payment of their care because they're not under a protective order under the county. As you also may recall, we do have our crisis diversion house, Calm Harbor, and we did service 93 people there last year for 888 bed days, which if you do an average cost of $1,000 a night, did save the county about $890,000 a year. Those are our numbers, and I just wanted to see if there were questions for me about the 2020 inpatient hospitalizations.
I would assume this is always a difficult account to try and guess what to budget for because you never know how many people are going to be coming into the system and where they're going to be placed. So with that, does anyone have any questions?
Oh, there we go. Julie, just one question. You may or may not know the answer, but that's a substantial increase, 51%. Are we doing something differently that's really causing that increased percentage, or is that just systematic of kind of what's happening in the community at this time?
Generally, when it comes to crisis intervention, we've been seeing the increased need grow every single year. And so that I wouldn't say that increase is like, year over year. It's just a general increase that you're seeing across the state for need. In the state is trying to respond to that growing need across the state by trying to budget for some regional crisis centers, some other types of interventions. We've been doing some specific work here in the county to try to respond in a different way and partner with law enforcement. But in general, it's just indicative of the growing need within the county and the changing of the needs within the county. Certainly, I think the pandemic has put an exclamation point on the needs of folks in the community with, social isolation and, lack of access to services and things like that. So it's hard to say, but it's just a growing need across the country, really. Mm-hmm.
Thank you, Julie. Thank you. All right, on to our action item. This is going to be one of the, if not the biggest decisions that the county board will be making this year. So I think our county executive did the residents of our county a great service by assembling this Samaritan Task Force of people throughout the county to get some input from them and to get a recommendation from them to answer a very important question. So with that, we're going to start this with a presentation by Paul Roback, who's our professor and community development educator. So, yes. Oh, yes, I'm sorry. Sarah, you are excused if you so wish, but if you want to stay and listen to this discussion, you're very welcome to do so. Okay, thank you, Mary. Okay, Paul, I'm going to turn it over to you. You've got the floor.
Well, good afternoon. My name is Paul Roback, as Chris said. I work for UW-Madison Division of Extension, Washington County. It's a mouthful. So essentially, I am a UW employee under contract by Washington County to provide education and facilitation and research for local governments and nonprofits in Washington County. So my role in the Samaritan Task Force was to assist with facilitation and development of the process with the task force, as well as facilitating the meetings, writing the report, and also presenting the report's findings to all of you, both here and to the county board. As you can imagine, I'm not an expert in a lot of the details that you'll be hearing about today. I've learned quite a bit, as well as many of the task force members have as well. So I do want to mention that we do have a number of guests in the room who will help answer questions when we get to that. So I'll give a presentation, then we'll have the chair of the task force come up and make some brief comments, and then we'll open up for question and discussion. And I will probably refer those questions to a number of the guests in the room, from Julie and Mary Beth to Patrick Carroll from Whipley, who you heard from last August. And then we have 3 of the task force members here with us today: Craig Scotonico, Gina Whitley, and also Deb Anderson there. And so I'll introduce the rest of the task force as we get into the presentation as well. So I just thought I'd provide a little bit of overview of who I am and how I got involved with this fun activity. So can you share my presentation slides? So by now, I believe everyone's pretty familiar with Samaritan, and that the county's had a long history of providing care to senior individuals in the county. So the nursing home itself opened up in 1968 with a capacity of over 300. It was renovated in 2009. We added the fields in 2006 to expand long-term care. So this evening, I'm going to be using the phrase assisted living quite a bit. And assisted living will include both the community-based residential facility, the CBRF, and the residential care apartment complex, RCAC. I'm not going to spend too much time delving into the differences, nuances between both of those, other than to say that when I speak of assisted living, that's what I'm referring to. The campus currently accommodates 131 skilled nursing residents. Of course, the current population is less than that, 31 CBRF residents and 24 RCAC. And each one of those nursing home is 24-hour care, CBRF up to 3-hour limit, and then RCAC up to 28 hours of total care per week. Did I do that right, Mary Beth? Thank you. So as you recall, last August, you had a presentation by Whipley, as well as Mary Beth and Julie Driscoll, on Samaritan, as well as the market and financial analysis projections moving forward. And as you know, nursing home reimbursement rates have not kept up with costs. Fortunately, with our enterprise funds, it's been in recent years cost neutral for the county. But as we progress through the presentation, you'll see how that may change, or most likely will change as time goes on. The Samaritan Nursing Home requires millions in renovations. In fact, that's $5 million over the next 5 years. So you heard all that information last August, and the county executive said in his next steps that he would form a citizen task force to delve into this topic, to learn about it, and to make a recommendation to all of you. In the county executive's proclamation, really the goal of the task force is to recommend answer the question, essentially, should Washington County remain in long-term care nursing home services? So it really is a should question. Should the county continue providing these services? Now, it also gets into the how question, right? Of how should the county go about doing those services? So even though the charge was should, it's really difficult to separate the two from each other, the should versus the how. How should the county do it? Should it continue with the status quo? Should it build new? Should it sell? Should partner with somebody else? So there's a lot of ways in which you can go about that. But really the focus of the task force initially was to answer the should question. The county executive's proclamation recommended different types of individuals to serve on the task force. So may include up to 4 business or nonprofit leaders, of which one may be a resident or family member of a resident of a senior living facility. One may be affiliated with a long-term care industry. One may work in the healthcare industry. One may be a current or retired direct care worker in a long-term care facility, and up to 2 additional public members. So with kind of those parameters, these individuals applied for and were recruited to serve on the task force. I already introduced Deb Anderson to you. Those of you who may not know Deb, she has been involved in the community for a long time, and is current board member and past executive director of the Senior Citizens Activities Incorporated, commonly referred to as the West Bend Senior Center. And then she's also been involved with several long-term care organizations through the years. Nick Bush works for Direct Supply Brands. If you're not familiar with that company, they develop products and solutions for senior living industry, including skilled nursing and assisting living facilities. Del Ellison is a retired registered nurse, and he's past owner of and operator of several assisted living facilities. Jason Hartland is Chief Revenue Officer for the Milwaukee Brewers Baseball Club. Donna Nash was the vice chair of the task force, and she works for Workforce Health, which is part of Freighter and the Medical College of Wisconsin. They do workplace wellness, workplace clinics, occupational health services, and customizable healthcare solutions. Craig Sedonico, who many of you know as former mayor of City of West Bend and also president of American Companies, and who's with us, as well as Gina Whitney is with us, who's a financial representative and also has a family member who is a current resident at Samaritan Nursing Home. So with this group, we also have they're all county residents. 2 of them reside in Germantown, 1 in Erin, 1 in Slinger, 2 in West Bend, and 1 in Allenton. So pretty great geographic representation around the county, as well as experiences to lend advice into this process and expertise into this process for us. So the process was pretty quick. As you saw in the report, they met 3 times in 5 weeks. So it was a very intense process, and one that went relatively, I'd say, really smoothly, and was very productive. So the first meeting was really an opportunity to hear all the information that the county board heard last August. So Julie Driscoll gave the same presentation, Mary Beth gave the same presentation, and Whipley gave the same presentation on the financial market analysis and future projections. So a lot of data presentation at the first meeting, and in fact, a lot of data at the second meeting as well. At that meeting, we brought in representation from Wisconsin Department of Health and Human Services, from both the Bureau of Assisted Living and the Bureau of Nursing Home Resident Care. Those 2 individuals presented by Zoom. They didn't provide any additional handouts. Essentially, Alfred presented information about that the Bureau of Assisted Living really oversees the community-based residential facilities, the adult family homes, the residential care apartment complexes, and adult daycares. He really mentioned that the assisted living facilities is a fast-growing industry, and it's anticipated to continue at its fast-paced growth. Anne, with the Bureau of Resident Care, really talked about the trends in Wisconsin nursing home industry in the past 5 years. 46 facilities across the state have closed, and that there's a need for providing more dementia care throughout the state. The next presentation was from John Sauer from Leading Edge, who really provided a lot of data on demographic trends in Wisconsin's aging population, the challenge of finding long-term care workers, the growth of assisted living facilities, while nursing facilities have decreased, and Medicaid's underfunding of nursing facility residential care. So getting older and also more difficult in finding and recruiting a workforce to work at these facilities, and then Medicaid isn't fully funding the expenses of the nursing operations. The last presenter was Brian Schreinick, who retired from Leading Edge, but has a wealth of experience and really provided insight into nursing home closings across the state of Wisconsin, and that there's been 19 of them since 1986, and what the implications of closing those facilities have been in communities, as well as potentially could be here in Washington County. So with all that data that was presented, the third meeting was really focused on answering questions, as well as having a facilitated conversation, identifying the benefits and limitations of the county continuing to provide long-term care services, and then really come down to making a final recommendation to you. So throughout that, I just wanted to mention a few of the what I'd say are the key considerations that the task force considered. So although the county is not mandated to provide long-term care services, it has provided these services for over a century. However, the county is required to fulfill Chapter 55, which is provide emergency protective placements. And you can see from the data there that there was 28 Chapter 55s in 2020. 10 of those were placed at Samaritan. And Samaritan's the only facility in Washington County that accepts Chapter 55s. Did I get that right too? Okay, thanks. Most often Samaritan can bill insurance for the cost of the stay. If these 10 individuals were placed in another facility, it probably would have cost the county another $258,000. As I mentioned before, with the facilities assessment, Samaritan needs $5 million in investment over the next 5 years for the facilities. And even if you made all those changes and improvements, and they're very critical improvements, you'd still be left with an outdated facility that would be kind of hard to move forward with. So as you know, Samaritan is cinder block walls, great for longevity, but very difficult with current technologies, wireless technologies, and flexibility of the space. The status quo financial model is projected to have a deficit of nearly $1 million in operations by 2025. And that's largely due to the assumptions of annual pay salary increases around and benefit increases around 4% versus the Medicaid reimbursement rate of an annual 1.5%. Constructing a new facility, it's estimated that would cost between $20 to $25 million. And the county is currently exploring a partnership with third-party provider that may result in updated facilities and a lower operating cost from shared services. So those are all the key considerations to really come down to these 3 bullets here. So the task force discussed and identified that the status quo is largely not an option due to the age of the facility and the maintenance cost. A new facility may not be financially acceptable, and a third-party provider partnership may provide the proper balance of balancing both the financial and moral obligations of the county. So moral obligations is loosely defined as the county being really that safety net service for people that are most vulnerable and most in need in the county. And with that, that brought us to the recommendation. And as I said, the recommendation answers both the should question and the how question. So I underlined the should there for you, and that the county should continue to provide long-term care services while balancing financial and moral obligations through a partnership with a third-party provider with up to $500,000 in annual levy support over a 20 to 30-year lease term. So this was a general consensus of the task force. There was one individual who disagreed with the general consensus, or preferred, I should say, really preferred that the county not compete with the private sector. That task force member believed that current assisted living facilities such as RCACs and CBRFs can handle the need in the county, whereas other task force members disagreed with that belief. After the last meeting of the task force, we did evaluate the process just to make sure that we kind of hit our marks with the task force and making sure that the task force operated in the way that we were hoping it would. And you can see that task force members agreed or strongly agreed that the objective was clear. The presentations helped inform the decision-making process. They all had the opportunity to contribute to the final recommendation. One of the responses was neutral towards that their participation allowed for an increased civic engagement with the county. So it wasn't that they disagreed with that statement, they were just neutral on it. And then there was agreement with being on the task force was a valuable use of their time. And then we also asked the final recommendation in front of you, when we were brainstorming it and developing it in person, and we typed up the notes afterwards, a little wordsmithing was needed. So we just wanted to make sure that the wordsmithing did in fact reflect the task force recommendations, and you can see that 100% agreed with that. So with that, I'll invite the chair of the task force to come up and share a few comments with you.
Thanks, Paul. Good evening, everybody. I'm Craig Sedanico. Nice job giving thanks out. Thanks, Chris, you mentioned thanks to County Executive. We certainly echo that. Our task force members echo the thanks. Appreciate this committee's support, the county staff, as well as the full county board. We think it's great to get public engagement. As naive as some of us, and I'll say me, may have been in this, in the world of the Samaritan, I certainly learned a lot in our 3 meetings, 6 or 8 hours that we were together. Paul did a nice job of talking about how the should and the how. Should the county stay in the business? How should the county stay in the business? That was something that we discussed quite a bit. It wasn't really a no-brainer. We, I don't know if we debated, but we certainly had all voices heard. And we really did come up with a recommendation that we feel balances that moral obligation with financial responsibility. We do feel the county should stay in the business if it can partner with a third party, as was described to us, with a maximum levy outlay of $500,000 at some point through a 20 to 30 year lease process. Be happy to answer any questions that you may have of me, and I'm sure the other task force members would be happy to speak if there are any to us. Otherwise, thanks again, and don't lose our numbers. I'm sure we'd all like to volunteer again to the county.
Does anyone have any questions? Well, you overpowered us, I guess.
Thank you, guys.
Thank you, Craig.
Thanks, Greg.
Yes. Would any of the other task force members like to say anything? Don't be shy. Okay, thank you. Okay, go ahead.
Okay, you answered the question essentially that we should if we're able to partner. What if we're not able to partner? Are we not really worried about that right now or exploring that? Do you have any preliminary thoughts on that? Or did you not invest any time in that? Let's just do step 1 first.
Got a few more steps to go today. We did. We went, we came up with 4 different options. Status quo, basically do nothing, remodel the existing facility, demo, build new, or partner. And we one by one eliminated those other options through various reasons, whether it was cost or cost combined with the fact that remodeling would still leave us with an outdated facility. I don't know that our answer would have been no, the county should not be in the business any longer if we can't partner. But the information would have been overwhelming. I think we identified the best option and one that staff felt was at least reasonable, reasonably good chance of happening. And we weeded out the other three, as I mentioned, for various reasons. We really didn't have a plan B. Again, the cost really became overwhelming. And of course, given no financial restrictions, it's a pretty easy decision as to what the county should do. And given no moral obligation, no morality with any of us, it'd be pretty easy to determine what the county should do. But because we do all have morals here in Washington County, and because we do have some financial restrictions, is why we wound up with the recommendation that we did. And I think it would open up another discussion if that option wasn't available. That make sense?
Yeah, thank you for clarifying. Yeah, and I truly appreciate all the work that you all have done. I am a nurse myself, a good 30 years, and when I went around campaigning last year, this was one of the reasons I did accept that tap on the shoulder, actually, even to Ron. I was not looking for this. But I guess it was in God's plans. But people had a lot of sense of pride, and I know I've repeatedly shared this. When I went around to my potential future constituents, they did have a lot of sense of pride in the Samaritan. And we're hoping that we could figure out a way to keep these services. And the individuals did, I mean, very conservative county, especially too, I'm in the town of Polk mostly and part of Jackson, very conservative individuals were even willing, just in casual conversations, willing to support a potential levy because I prepared that for them, prepared them for that potential. But so thank you very much. This is extremely important work that will, affect a lot of people's loved ones over the next 10, 20, even 30 years probably. Thank you.
Are we on? All right. I've been talking to a lot of people. I have been talking to people since I got out of the hospital about Samaritan. I think the general consensus, a lot of people feels that the county should not foot the whole bill. 20, 25 million is a lot of money, especially when we're talking about the, not that I'm against the project, I'm not. But general talking to people saying that we should, I talked to Don a while back about the partner thing. That sounded great. But for us to fool the whole bill, there's a lot of mad people out there, but I'm just saying, if we could find a way to just half and half, I think it would be all right, but who knows? Thank you.
Anyone else? Go ahead, Melissa. I thank you too for the hard work that you did because I watched all the meetings and I could see that there was a lot of thought and a lot of work that you all put into it. So I really am grateful for that. It makes our job a little bit easier. But some of the, I'm sort of a detail kind of person. And so the one thing that I'm particularly concerned about is if we move into the partnership, understand that we'll be downsizing the number, and I'm going to just direct it to you two. So we'll be downsizing, even though in the next 20 years, I think I wrote this down right, the baby boomers, and I've just looked at it from 85 and up because I'm assuming that's when most of the necessary skills are needed. It's going to double from about 3,000, almost 4,000 people to almost 8,000. And currently we have about 70 or 80 in the Samaritan. So I'm wondering, how do we balance that in the next 20 years as to how do we, just mathematically, I looked at it, does that mean it's going to double? And how are we, if we're downsizing, how do we meet the need?
Right, right. Well, it's all a projection, of course, and so no one really knows, but excuse me, what we're truly betting on is that the state is wrestling with this problem as well as the federal government. And I don't think they could afford to keep the model that we presently are in. And that's where we see a change. And so the downsizing portion, first, let's talk about the macro level. The macro level is that as time goes on, we're going to find that the restriction at the two levels of assisted living will be increased, allowing more beds to be open for more severe cases, not to the point of skilled nursing, but the RCAC will begin to start taking more of similar cases that the CBRF would take. The CBRF will begin to take more cases that the skilled nursing facility presently takes. It's no different than a few years ago when hospitals started releasing people sooner and they still needed rehab. Before, rehab was done right in the acute care or the hospital setting. Then that shifted to assisted living. And that's partly what we see will happen. The second piece of that is if we stay, Whipley did an excellent report, and what they said was if you stay in the business with the present building and the present census, you will probably lose $1 million a year. So one, we have to figure out if we downsize, what would be the loss? And as Craig had mentioned, we don't anticipate if we do something that we would immediately meaning 22 or 23, require $500,000 for operational expenses. But as time goes on, we don't want to try to sell something like there would be no additional tax levy need to operate a nursing home, but rather we project that as time goes on, the need would probably increase. So that's where that 500,000 came into play. If we downsize, we would take what I think the future will demand of skilled nursing SNF care. And that's where we're looking at the possibility of 131 down to 70, maybe 80 at the most. I think probably 70 today. We have 75 census we're running. So that's what we're looking at. Secondly, or thirdly, I lost track. What we're looking for is we're looking for a design that if it becomes more severe, that you need less skilled nursing, more assisted living, what we will do is we will design the 70-bed skilled nursing to be able to be converted into at least half that would be CBRF instead of skilled nursing. So to meet that need, that population, and not put undue costs onto the county. So we're looking at all the different aspects as we look forward to this possibility. What I'm hoping is that the county board would allow us to study further. And like you're saying, that we don't have all the details yet. We'll have much greater financial projections along with Whipley will be cranking numbers for us. They're presently looking superficially at this point, but looking at a scenario 1, 2, or 3 that would, what if with a public-private partnership, what if we would renovate 1, 2 floors, maybe even partial third floor at Cedar? What exactly would that look like financially? The goal for Whippley is to look for a win-win scenario. And that meaning Cedar campus would have to gain from this and the county would have to gain from this. So we're looking at those possibilities. If in fact that's not feasible, then we will crank numbers and looking at what if we build new. And it will not be 20 to 25 million that the county taxpayers directly would pay for. It would be us taxpayers in general through reimbursement. A lot of the building expenses would be covered through your census. So we get a portion of new construction reimbursement back. So it wouldn't be a clear cut 20 million or 25 million, but the county would be obligated to pay that debt off should we close. So that part is a risk. So I'm not sure if I answered your question.
Kind of, yes.
Well, if you ask me a follow-up,
Well, my thought was more on the line that it looks like it's going to increase just simply because of the baby boomers. And I expect then quickly after that, it will drop. So we don't want to, on the other hand, we don't want to overbuild again.
you're exactly right.
And the other,
baby boomer bubble will hit peaks in 20 years from now. It will be diminished by 30 years from now. So we don't want to overbuild. That's for sure.
Mhm.
Secondly, we know if we build according to what the projections show, we'll never be able to pay off that debt. We know if we cut it in half, we have a good possibility that whatever we do would be paid off in 20 years with a cushion of 10 more years of higher census. And then after that, 30 years, we could close it down.
Mhm.
The county board at that time would have to determine, and I am certain there would be new models. Well, I'm planning to be there to help you.
I-
Yeah.
I
Is that loud?
I was somewhat impressed with the fact that Dell, who was he had private nursing facility, felt that he didn't think we needed a Samaritan at all, that he thought it could be completely done by the private sector, which I'm not sure that I feel that way, but I mean, it made an impression on me that he said that, and I know he believes it firmly. So there is something out there that maybe private sector picks up if we're not able to meet all the needs. I would expect that most of the people who have private insurance, they're probably going to go there. I mean, they're going to go to private rather than to I don't know if you're going to call it the Samaritan. And then the other thing I'm thinking is the trend is that most people don't go into a nursing facility until they really, really need it.
Yes.
And their stay is unfortunately shorter.
Yeah.
And it is better to be at home. So I'm taking that into account. And I think maybe that's part of your answer, or?
That is part of the answer,
Okay.
where as time goes on, more people will stay at home longer. Then they'll go into RCACs at a later age, then they'll go into CBRF at a later age, and finally they'll go to a skilled nursing.
Mhm.
I don't know in 30 years if there'll be such a license as skilled nursing. I'm not certain. That's just like I worked in the hospital industry for years, and we were always told it's going to close, that we're going to have a different model, and but it's hard. It's easy to say that. It's very difficult to project and develop a financial model that works. And that's the problem we're facing today. And that is simply the private sector. They're out there, but they're unwilling because they're in there to make a profit.
Mhm.
And I'm not saying that like that's some sin. To stay in business, you have to live. You must make a profit. And reimbursement for Title 19, it was never to pay fully the cost of care. Their plan was have a balance, a sufficient number of private pay, and charge them more than what the cost of delivering that care would be to make the profit, so that you can take the Title 19 where you receive maybe 80% of your costs to cover, but you'd balance it. Well, what the county does is we try that model, and to this day, we're using that model. But as time goes on, the need will be greater and greater that we can only take the Title 19 because no one else will take them. And that's where we start developing, and we threw in the guesstimate of 500,000.
Carol is here from Whipfly. Do you have anything you want to add to Lois's initial question? Thank you, Craig.
So your question regarding the baby boomer generation, that's a tough one where we're at right now with short-term planning versus long-term planning. The first set of baby boomers just started turning 75 in 2021. And you were right on. In any given senior living setting, the average age of those individuals are 85. So we're 10 years down the road from hitting that first front end of that baby boomer bubble, and potentially an increased need for beds. The 5-year period, you're looking at current status quo and projecting those operations, not anticipating increase in occupancy. So how do you address this 5-year period while planning for the long term? And when you start looking at the long term, Matt hit on a lot of it. You don't know how much acuity is going to increase in the assisted living setting, and will that trend continue? It's been a decrease in nursing home utilization and a shift towards assisted living for the past 30 years. You have to assume that's going to continue, but also it'll be offset by the population growth. By how much, it's hard to say 10 years from now. The other factor is the home care services. We're seeing utilization there increase. So how much of a shift will people that are currently in skilled nursing be taken care of by home care? So what Matt and the team is working on is, we have the current facility that needs to be addressed right now. We know that we're not going to have an influx from the baby boomer population in the next 5 years. That's coming 5 to 10 years down the road. And so that's kind of what is driving it. And Matt also hit on the second point is, hopefully in the future, the counties allows them to continue to plan. And then you have a little more clarity as to 5 years down the road, all right, what's the impact of the baby boomers on the skilled nursing versus the assisted living versus home care? And the other aspect is reimbursement. Paul hit on the nursing home closures over the past years. The state is starting to recognize that as an issue. And potentially, will we have better increases annually in Medicaid reimbursement? That's another big unknown. So not a clear answer for you.
I would have to say that $500,000 a year to take care of our vulnerable seniors, it's a pretty good deal.
Mhm.
I mean, for the county, I mean, $500,000 when you look at our budget is not much money.
Mhm.
It's a lot of money, but
Right.
in comparison to the entire budget, it's really a drop in the bucket.
Right. And to the comment about the private sector jumping in to assist with that. Today, they're not doing that because the reimbursement rates do
Mhm.
not cover the cost of care.
Mhm.
And again, that's another area, going back to my comment about reimbursement, what will that look like in 5 to 10 years? Will the private sector be able to jump in more because reimbursements improved?
Well, they're going to face the same problem.
Correct.
Do I build for this and then 20 years later it's gone?
Mhm.
Because it's not going to continue.
Right.
So, I don't see the financial model really working that well for them either.
Right.
Anyone else have questions for Patrick? Well, we have him in the hot seat.
Yeah, just kind of playing off Supervisor Lois Gundren's comments too about the 500,000, kind of a drop in the bucket. We think this is our most vulnerable population. We do have a moral obligation, and we provide fire, EMS, school, our school budget. I think we have to look at the trajectory of life here,
Mhm.
or that we are morally obligated.
Mhm.
And yeah, that little bit compared to what we spend on everything else, I hope people find it morally acceptable there too. But a concern of mine is too, like Supervisor Gundrum was concerned about, is the number of beds. We speak of a 50-bed plan and to help for better reimbursement. Currently, Samaritan census is around 75. So we say we get this ideal, what it seems, according to the task force situation, we partner with Cedar Lake campus, we open up with 50 beds. 50 beds are full, and they're constantly full, and we're not meeting the needs of the community. And we've gotten rid of those other unlicensed beds because we're licensed over 100 beds right now.
131.
And there was a presentation on how hard it is to get licensed beds back. Even a facility asked for, say, single digits, only 2 or 3.
Right.
So I think we need a little contingency plan.
Well, so on the 50 beds that you're talking about, that would be proposed if there was a new building project. And the reason for that is the state's reimbursement. There's an incentive if you have less than 50 beds. So it improves the reimbursement. And it's not Whipley saying you should do 50 beds. It's saying, here's the financial model and the financial impact. My understanding from the partnership is that it would still be downsizing, but to Matt's point, it'd be more like 70 to 80 beds, somewhere in that range.
Oh, so it wouldn't be down to 50.
No, that's,
Okay.
we're speaking 70 to 80. We're speaking of the CBRF going from 31 to possibly 34.
Thank you. I'm
Yeah.
sorry, I must have misunderstood that.
No, it was a new building, and that was something we projected in August.
So the CBRF, if I'm getting this right, the fields, does that stay?
The fields is an RCAC, and that will stay as a building. The question will be, do we operate it or do we sell it? And that is something that part of our proposal when we come back to this committee and the board, if the board allows us to explore it further, we'll have that as an option as well.
Okay, so the 70 beds at this other facility or the lease, I don't really think of it as partnership. It's really a lease.
It's really a lease.
It's- yeah.
Yes,
So that's the CBRF and then the skilled nursing
yes,
combined.
yes. Well,
No.
they're separate licenses, separate locations, but that's all one package. 70 to 80 skilled nursing and 31 to 34 CBRF.
Okay. Thank you.
See, one of the issues with the RCAC is one, it'll be separated, but I'm already working with Cedar. Should we go down this path, would they deliver meals 3 times a day? And they're working that into the whole formula. So if we maintain it. Part of the argument is when I first arrived here almost eight years ago, the push was we don't want to compete with the private sector. RCAC competes with the private sector. It's so if the model that I think will happen, that the state will begin to allow more critical care levels at each of the other assisted livings, then I think what'll happen is they'll open the door for more and more family care. And then we're truly not competing with the private sector, because most of the private sector would prefer private pay. And so then that argument says we should maintain an RCAC along with a CBRF and a skilled nursing. If on the other hand, that the state decides to fund the family care at a higher rate, it's possible the private sector would want family care. So it's sad to say, the last time Leading Age did a study, it showed that the state of Wisconsin out of the United States was the 4th lowest reimbursement for Title 19 out of 50 states, which is sad.
Mhm.
And that's why nursing homes are closing.
In our current situation, does the RCAC contribute a lot of profit and that's why we do not have to levy?
In part, they do.
Okay.
Yes.
The RCAC is approximately 60% private pay residents right now.
So you're going to create models that may not have the RCAC in it because you're talking about possibly selling it. And that will be part of the board's decision?
Yes.
Okay.
We will show models and different options.
So what we're voting on now is, do we move forward to go to the board? And then when the board gets this, they're not going to actually make a final presentation. They're going to say, go ahead and explore this and then come back with the final options?
Chairman Dice has a resolution that is asking for that very thing. Should we continue in the business? That's what we asked the task force to
Okay.
tell us, not not giving a rubber stamp to anything
Okay,
other than, should I start looking before I retire to close Samaritan? Or should I start looking at a replacement? And what model makes the most sense?
okay, thank you. I appreciate that.
Oh, we have him. Okay, thank you. Any other questions? Peter?
Okay. Again, I don't want to be a downer, but $20 million is a lot of money. And do I want to put people on the street? Absolutely not. We got to find some way to make it, because I heard people, well, we're not in the golf business. Well, we got a great golf course, but this is more important. I hope we can put something together, because 20 million not looking at your taxpayers' eyes is not going to fly. They're not going to be happy with that. But again, we're still in the stages here, but let's hope we can get this done now by. Okay, thank you.
Okay. Thank you, Patrick.
Thank you.
All right. In the paperwork that you were given, there was a proposed resolution. And what I would ask is, or I would entertain a motion to approve that resolution and forward it on to the county board. With respect, Pam, to the comments you brought up earlier, we did add the word in line 27 of that resolution, that the Washington County Board of Supervisors, that this board hereby approves the concept of continuum of care for county residents with the preference that a public-private partnership model be utilized. We added the word preference in there because we're still in the exploratory stages. And we didn't want to tie the hands of the county board to just that element. Although I think that is our preference. It seems to be a great solution for what we're looking at. So I think that kind of takes care of what you had asked about earlier. So with that, I would then entertain a motion to approve that resolution and forward it on. And second by Peter? Okay. Any further discussion? No. Okay. No further discussion. Then all those in favor, please signify by saying aye. Aye. Opposed? And that motion carries. Okay, then our next meeting will be Wednesday, April 28th at 4:30 p.m. I would urge all our county board supervisors, if they have not watched the task force meetings, when they occurred on YouTube, they are available there, I believe. We can still access them. So I would encourage them to review those before our next county board meeting, as well as this meeting. That being as it may, there is no further business before the committee, so we stand adjourned.